The necessary steps to complete before you start to don your PPE or personal protective equipment for access to an Ebola patient is to remove all jewelry, including earrings, cell phones, personal items, and secure them in an employee locker if available. Take a bathroom break, remove all your personal clothing, dress in scrubs provided by UHS, tuck your scrub pant legs into your socks. Use Crocs if and when they are made available. Secure your hair as necessary using a net, ties, or a band. Secure your glasses with tape if applicable. Take and record your vital signs, temperature, pulse, respiration, and blood pressure. And document. Drink fluids. You want to keep hydrated before donning your PPE, at least 6 to 8 ounces of water. Now, you want to make sure that your buddy is present when you begin your donning procedure. And the first step that you're going to do is to perform hand hygiene. So both of our caregivers will perform hand hygiene, always making sure that the hand gel dries completely. Inspect the PPE to make sure that everything required is available in all the correct sizes that you require. And the first step is going to be to apply your surgical boot covers. The covers should be at least up to mid-calf level. And it would be preferable for you to sit while you do this. There's less potential for you to rip the boot covers. And you'll notice that Julia and Candy are doing the outside ties for extra security. The next step in your donning process is to apply your mask. Adjusting the ties to ensure a snug fit. One tie goes up around the back of your head, and one tie goes around the back of your neck. Adjust to assure you have a snug fit. The next step in the process is to apply your surgical hood. Cross the ties and then tie around the back of your neck. You want to inspect each other and make sure that the plastic portion of the mask is inside the hood. The next step in the process is to apply your nitrile gloves, which fit snugly. Now the next step is to apply your gown, with your buddy helping to assist with the ties. You'll note that the buddy's helping to tie the inside tie on the back of the gown and the Velcro tab at the top of the gown. And then the outside tie is tied at the front left of the gown. You want to make sure now, looking at your buddy, that the hood does come down completely under the gown so that your neck area is not exposed. And then assure that your cuffs of your gown are down over the nitrile glove cuff. The next step is to apply your face shields. Inspect each other to make sure they're applied properly. You're going to apply a second pair of long cuff gloves over the first pair of gloves.
Daniel Day, 2151.
When you apply this set of gloves, you want to make sure that the glove cuff covers the gown sleeve adequately to prevent exposure when providing patient care. Do not use tape on the long cuff gloves. Your buddy is going to inspect to ensure that no skin is exposed. And now you're each going to perform some range of motion while your buddy inspects you to ensure that your arms, legs, and torso are fully covered. And the last step is to perform hand hygiene with the gloves on with an alcohol-based hand gel, giving adequate time for drying. One key factor is to note that both caregivers took their time during this procedure, slow and steady, assuring that each step is completed before moving on to the next step and assuring that all skin areas are adequately covered. At this point in time, Candy and Julia have finished performing care for the patient in the patient's exam room, and they're going to proceed with the doffing procedure. We are now in the patient's room. The doorway you see behind Julia is the door leading out into the hallway. And so Candy and Julia are going to begin the doffing procedure. Each person in the room will look for any visible contamination, cuts, or tears. Remember, do not hurry. Take your time to doff safely. Wipe away any contaminated area with purple top wipes to clean. Strictly adhere to the wet time whenever wipes are used. The wet time is a 2-minute wet time. Disinfect your outer gloves with purple top wipes. They're going to disinfect their outer gloves with a purple top wipe, and then they're going to remove their outer gloves and apply a new set of outer layered gloves. You'll note that they're using glove and glove technique. They're grasping the left glove on the outside of the cuff area, not touching the inside glove. Now they're going to apply new outer gloves. Once the new outer gloves are applied, they are now going to place down a clean draw sheet on the floor in the area right next to the door to the hallway. This will be the pad that they will use for their doffing procedure. You want to be careful not to step on the pad. The pad needs to be relatively clean, working from a hot end, which might get dirty with their feet, to the cleanest end over by the door. You're going to move the chair to the edge of the sheet. You're going to move the red biohazard garbage can to an area close to, but not on, the draw sheet. Now you'll notice they have a perfect pad area ready to do their doffing procedures. They're going to wipe the chair down using purple top wipes. They're going to utilize the purple top wipes, which have a 2-minute wet time, and they're going to use the 2-minute wet time and allow the chair to dry. Now, for training purposes today, we're not going to wait for the full 2 minutes. Now we're going to proceed to removing our boot covers. The first person, or the one most likely to need help with boot cover removal, will sit in the chair first. Do not cross your legs. This is important because you do not want to contaminate your scrubs with your boot covers. She's going to untie the ties on the boot cover and then slowly grasp the outside surface and slide the boot covers gently downward until they're completely off. The second person can assist with this process if needed. Once she removes the boot cover, she's going to place her clean shoe on the doffing pad. And the boot covers will get discarded into the trash. You want to make sure when you remove your boot covers that you do not roll them down your legs, that you slide them gently down your legs, because rolling the boot covers down will expose your scrubs underneath to your dirty gloves. Now, once Julia discards her covers in the trash, she's going to stand up on the pad. Once the second caregiver helped to perform boot removal, her gloves are potentially contaminated, so she needs to remove those gloves. She's going to start by performing hand hygiene with the hand sanitizer, the alcohol-based hand gel. Once that hand gel is fully dry, then Candy is going to remove her outer gloves using the glove and glove technique. She's going to grasp the left glove on the outside area of the cuff, not touching the inside of the glove. She's going to remove that outer glove in a slow, steady motion. She's going to hold the removed glove in her right hand and then proceed to insert 1 to 2 fingers of her left hand inside the cuff of the right hand outer glove, being careful not to touch the outside of the glove, and pull the glove down over her hand inside out, keeping the removed glove from the previous hand contained inside. Then she will discard her gloves in the red trash. You'll notice that Candy did not step on the doffing pad as she moved to the red trash. That's important because the doffing pad is a clean area. Julia, whose shoes are clean, can walk on that pad at will. Now that Candy has removed her outer set of gloves, and with using glove and glove technique, she needs to reapply a clean pair of gloves before proceeding to remove her boots. Candy now has on her outer set of gloves, and before proceeding to remove her boots, she's going to help Julia disinfect her outer gloves. Julia will disinfect her outer gloves with alcohol-based hand gel. Once the gel is dry, Julia will then perform glove and glove technique to remove her outer gloves and discard them in the red trash. Once this step is done, Julia will now only have on one set of gloves. And Julia will wait for Candy to remove her boots. So Candy, the second person, will now wipe down the chair using the purple top wipe with the 2-minute wet time. And again, for the purposes of the training video and time, we will not use the full 2-minute wet time. Candy will wipe down her chair. Then Candy will sit in the chair and remove her boot covers one at a time, grabbing the outside surface, untying the ties, grabbing the outside surface and sliding them gently down and off. As she removes that left boot cover, she'll place her left foot on the clean doffing pad and discard the cover into the trash. She'll then proceed to the right one, untying it, and again, sliding it gently down, not rolling it, and remove that boot cover. Candy will now step fully onto the clean pad, and then Candy will proceed onto the doffing pad. She'll refrain from returning to the soiled area from this point forward. Candy will now disinfect her outer gloves with alcohol-based hand gel. And Candy will remove her outer gloves, again using the glove-in-glove technique, and discard that set of outer gloves into the trash. Each caregiver will now fully inspect their inner gloves for any tears, contamination, cuts, and then they will inspect each other's gloves for any tears, contamination, or cuts. Now they will untie their front tie, and then they will turn their back to their buddy. And then they will untie their back ties. They will both each disinfect their hands using the alcohol-based hand gel after untying the other person's ties. Now each caregiver will remove their gowns, and an important part of this process is to assure that they keep their hands on the inside edges of their gowns. So they will gently begin removing their gowns by stepping on the lower inside edge of the gown to stabilize it for removal. And then they will keep the gown sleeves over the gloved hands as they're removing, pulling the sleeves inside out as you withdraw your hands. Do not let go of the gown. Gather the gown, keeping the dirty surfaces to the inside, and roll it up gently, top to bottom, and then discard the gown in the red bag trash. Each caregiver will now perform hand hygiene. And then they will remove their gloves using glove-in-glove technique and place them in the red trash. Once this set of gloves is removed, they will apply new gloves. Once the gloves are on and fitted properly, each caregiver will now begin to remove their face shield by holding the strap at the back of the head and removing the strap over their head, not removing their hood, and discard the face shield in the red trash bag. They will again perform hand hygiene with the alcohol-based hand gel. The next step is to remove the hoods, and each caregiver will help the other untie their surgical hood. And then each caregiver will lean forward slightly and remove the hood by grasping it at the crown of your head and pulling it up and forward and placing it in the red trash bag. Again, the caregivers will perform hand hygiene with gloves on by applying alcohol-based hand gel or foam. The next step is to remove their masks. They will remove their masks by untying the bottom tie first, then untying the top tie, and hold the ties in one hand and pull the mask forward and away from your face, being very careful not to touch the front of the mask. Gently discard the masks in the red trash bag. They will again perform hand hygiene with the gloves on. Now, the next step is to remove their doffing pad or their draw sheet. So they will stand just off the doffing pad close to the door to the hallway, and they will gather up the sheet by carefully rolling it with the dirty surface inward. Now they want to remain as close to the doorway as they possibly can, which would be the cleanest zone in the room. They'll gently place it in the trash and then again perform hand hygiene with their gloves on. Now they will signal the person outside in the hallway that they are getting ready to exit the room.
We're ready.
The person in the hallway outside the room will open the door, and the person in the hallway outside the room will be ready to place a chair in the doorway facing inside the examination room. The first caregiver will sit in the chair with their feet inside the exam room and clean their shoes with a purple top wipe, which is placed outside the door. So Candy will now clean her shoes with a purple top wipe. She will not walk back into the room once her shoes are clean. She will discard the wipe. She will remove her gloves using glove and glove technique and place her gloves in the red trash. Candy will now perform hand hygiene, but it's important that the person in the hallway hand the hand hygiene to her, and Candy does not touch the bottle. So Candy will perform hand hygiene on her bare hands with the other staff applying the alcohol hand gel. Candy is now considered clean and can walk away from the doorway entrance. She will complete a final visual inspection for any contamination. Staff are met outside the exam room with a clean gown, gloves, and mask, which she will apply prior to walking to the decontamination shower room. The second caregiver now needs to proceed to sit in the chair with her feet inside the exam room and perform the same procedure that Candy just did. Using a purple top wipe, she will clean her shoes. Once she's cleaned her shoes, she wants to make sure that she puts them in the clean area outside the room. Clean area outside the room. And she should not walk back into the exam room at this point in time. Julia will then stand up and remove her inner gloves using glove-in-glove technique. And place her gloves in the red bag trash. She will perform hand hygiene on her bare hands with the person in the hallway, the other staff, applying the alcohol gel. The person in the hallway will do a complete visual inspection, assuring that there's no contamination. Julia will now apply clean gown, gloves, and mask, and then proceed to the decontamination shower. Once the staff is in the decontamination shower room, they will discard their scrubs, shoes, socks, hairbands in the red bag trash. Crocs will be re-wiped and placed in a container for additional cleaning and reuse. They will proceed to the shower. After the shower, they will take and record their post-vital signs, temperature, pulse, and respiration, and blood pressure, and rehydrate.